Dear students, good morning to all of you. Welcome back to this virtual class. Last period we are discussing health system of India. We are discussing the infrastructure of health, role of private sector and ISM Indian system of medicines and indicators of health and health infrastructures. So whenever we are discussing that indicators of health infrastructures, rural health, at that time that reaches to our mind health system in India. India's health infrastructure and healthcare is made up of three-tier systems. These are primary, secondary, and tertiary. And primary healthcare education concerning the prevailing health problems, methods of identifying, preventing, and controlling them, promotion of food supply, and proper nutrition and adequate supply of water and basic sanitations. What are the problems are faced by in the rural people? These problems are to be identified and that should be controlled by these primary healthcare systems of three-tier systems. So proper nutrition and adequate water supply as well as the basic sanitations and that child health care or maternity of that maternal and child health care systems which is that against of the major infectious disease and injuries. So promotion of mental health and provision of essential drugs which are to be improved in our rural systems that depends on that primary healthcare system that we have already discussed. In rural areas, there are the doctors, nurses or the male nurses, female nurses or the compounders and different kinds of trained technique persons of the different kinds of the diagnosis which is done by the doctors, different kinds of that paramedical forces they are doing also that works. So among all them ANM, that is the auxiliary nursing midwife, ANM, auxiliary nursing midwife. Auxiliary nursing midwife, AUXILIARY, auxiliary nursing midwife, ANM. You have already known the first person who provides the primary health care in the rural areas. That ANM goes in the rural areas to provide the door to door services. In order to provide the primary health care system, that hospitals have been set up in villages or PMC and small towns which are generally managed by a single doctor, a nurse, and a limited quantity supply of that medicines. They are known as that primary health centers or PMC, or we may say that CHC, community health centers, and as well as that sub centers. So besides this, there is that secondary healthcare systems, tertiary healthcare system, and secondary healthcare systems where there is that hospital which is that better facility than that of rural areas. This is generally established in that district headquarters. There is that some better facilities of that surgery or that X-ray or the ECG, electrocardiogram, are called that secondary healthcare institutions. Besides this, when these facilities are not available above this, all these which have advanced level of equipment and medicine undertaken all these complicated health problems which could not be managed by that primary and secondary healthcare systems, then that refer to that tertiary sector systems, tertiary healthcare systems. So this tertiary healthcare system, one of the best example in front of you, All India Institute of Medical Science, New Delhi, Postgraduate Institute of Chandigarh, and Jawaharlal Institute of Postgraduate Medical Education and Research, Pondicherry, and National Institute of Mental Health and Neuroscience, Bangalore, and All India Institute of Hygiene and Public Health, Kolkata. Besides this, the government is also established the different kinds of AIMS in the different district headquarters. So these are the facilities which are given to that in the stages 3 tier systems: primary healthcare system, secondary healthcare system, and tertiary healthcare system. Besides this, we have already completed, that is that role of the private sectors, because medical tourism is that great opportunities. At present time, you have also seen, or you might have seen that TV news or read the newspaper about that foreigners flocking out to India for surgeries or live transplant, dental, and even of that cosmetic cares. So you might have also seen on the newspapers, there is the advertisement of the different private hospitals, those who are providing the different kinds of modern technique facilities, healthcare facilities. There are also, whenever the foreigners they are coming to visit our India for the treatments, they are also treating, when they are getting their services from our different hospitals, so that some kinds of incomes of our national income which is coming from that foreign countries. So more than 500 billion rupees a year through such medical tourism also we are getting as that some of our incomes. That is the Ministry of Tourism, Government of India, who is providing the data that in 2016 as many as that 2 lakh 1,000 foreigners visited India and for medical treatments, and this figure is likely to increase that 50%, 15% for each year. Experts predict that by this end of the 2020, that more than 500 billion rupees which may come from that medical tourism. So these are the different kinds of statistical data which is as for that health infrastructures. So I was given also detailed data. There is that some community and non-profit organization in healthcare systems like CMS, Chhattisgarh Men's Shramik Sangha, as well as the different kinds of Seva in Ahmedabad, Accord in Nilgiris. These are different kinds of voluntary organization and NGO. They are working in the field of that infrastructure of that healthcare systems. So as well as I was discussing is that 3.7% of GDP as per the year of 2016, which is expended for that medical facilities or government health spending all these facilities. Whereas the private people or that each individual spending, that is to be called that out of pocket expenditure as a percentage of current health expenditure, which is that 65%, whereas in USA that is 11.1% and Sri Lanka this is that 50%. So these are also some reports, statistical data which I was discussing in the last years, and this is that systems, Indian system of medicines, ISM. I was discussing also ISM, Indian standard of medicines. So about the GDP and their contributions, different ways. That is that six systems: Ayush, Ayurveda, Yoga, Unani, Siddh, Neuropathy, and Homeopathies. So there is the different hospital also, number of hospitals, number of doctors, number of healthcare systems. I was also discussed in the last periods or indicators of health and healthcare systems. Indicator of health and health infrastructures, a critical appraisals. About that, I was discussing that GBD, Global Burden of Disease. GBD, Global Burden of Disease. Global Burden of Disease, GBD. So on one study points that India has about that 1/5 of the world population, but it bears the fighting the 20% of the global burden disease. GBD or global burden of disease is the indicator used by experts to gauge the number of people dying prematurely due to that particular disease, as well as the number of years spent by them in the state of disability owing to the disease. So these are the different GBD and indicators of health and health infrastructures that critical appraisal market. This is the importance. And 3.7% of the GDP, percent of the total GDP, this is spent by the government on the health. This is very less, or we may say that abysmal low as compared to the other countries when we compare to that other countries like America, Sri Lanka, etc. So now we'll start the rural and urban divide, poor rich divide. Rural, urban, poor rich divide. People living in rural areas do not have sufficient health infrastructure that we have taken from the statistical data of the number of healthcare system, that is PHC, community healthcare systems, we have already discussed. So from this data, we can say that 70% of the population live in rural areas. 70% population in rural areas. Rural development के बारे में जो बात कर रहे थे हम, rural areas. But only 20% of total hospital, 20% of total hospital and 50% of the total dispensaries are located in rural areas. Dispensary 50%. तो ज्यादा कहाँ है? अर्बन एरियाज में. But only hospital in rural areas 20%. Hospital in rural areas, जितना भी हॉस्पिटल है, जितना भी डिस्पेंसरी है. Out of this 63%, which is also covered in the urban areas, and 30%, approximately 30% bed are available in rural areas. So how we can divide the rural and urban? 70% India's population live in the rural areas, but that bed, numbers of bed is, that is not that update. 30% beds are available in rural areas, and there are only 0.36 hospitals for every 1 lakh people in rural areas, while urban areas have in the 3.6 hospitals for the same number of peoples. The PHC, public healthcare system जो बात कर रहे थे हम, located in rural areas and do not even offer that X-ray machines or any kinds of testings like blood testing systems which constitute the basic healthcare systems. कुछ भी हो जाए, थोड़ा बहुत बुखार होने में आपका ब्लड टेस्टिंग फैसिलिटी होना चाहिए, ये नहीं है. If we will go through that our different states healthcare systems, so we'll observe or we notice that states like Bihar, Madhya Pradesh, Rajasthan, Uttar Pradesh are relatively lagging behind in these healthcare facilities. In rural areas, the percentage of people who have no access to proper healthcare facilities has increased over the last few years, but that much is also not up to date. In villages, there is no specialized medical care like pediatric wards, like gynecologists, any kinds of specialists are not available in rural areas. So we can divide that rural areas and urban areas like this. Even though 380 recognized medical colleges produced, remember it, as per the 2016 statistical data, 380 recognized medical colleges produce only 44,000 medical graduate every year. Still, the shortage of doctor in rural areas is persisting, continuing. It means that 20% of these graduate doctors leaves the country for better monetary progress or monetary prospects and opt for private hospitals located in urban areas. These kinds of doctors, they are not free to choose to stay in the rural areas for themselves and for their family members as well as for their children, what they think about their future prospects. So the poorest of the 20% of the peoples in India living both urban areas and rural areas, they spend only the 12% of their income of healthcare system, while the rich spend only 2%. Due to insufficient facilities in government hospitals, poor and given private hospitals, which make them indebted forever, many have to sell their land or even place their children to afford the treatments. So there is a sharp divide between the urban areas and rural healthcare systems, which we know very well about the three-tier systems: primary, secondary, and tertiary healthcare systems. If we continue to ignore the dependings divided, we run risk threatening to the socio-economic foundation of our countries. We have already known the morbidity rate, infant mortality rate, life expectancy, as well as different kinds of hospitals, beds, doctors, PHC, etc. etc. Among all them, if we will compare with that male and females, so women constitute although the half of the total population of our country, but the women people, they suffer the many disadvantages or that they whenever they will compare to the men. In the areas of education and participation in economic activities and health cares, although the child sex ratio declined, that is 914 in the population counting of 2011 census, but it was in 2001 927. It means it reduces 927 to the 914 from 2001 to 2011. After every 10 years we are counting that population, that census. So it means this decreasing 927 to 914 indicates that growing incidence of female ferticides in the country. You know very well why that female ferticides are increasing day by day. Around 3 lakhs girls below the 15 years of age are not only married but have already born children at least once. More than 50% married women between the age group of that 15 to 49 years have MNEs. That is that they have that different kinds of problems. Among all them, that anemic is the most important problems, and they are not getting that balanced neutral sports, iron deficiency, which contributed that one kinds of disease, as well as some women they are also death. Abortions are also major cause of maternal morbidity and mortality rate in India. So, in order to provide the basic health care to all, accessibility and affordability need to be integrated in our basic health infrastructure. It is important to create awareness on health and hygiene systems and provide that basic amenities in the rural area as well as the human areas. Latest by our governments, which is giving that one kinds of right, that is our human right, which is to be called that health a basic human rights. In order to provide the basic health care to all and accessibility of all that basic facilities, proper sanitation facilities, water facilities, hygienic facilities, it should be integrated with our basic health infrastructure systems. So ultimate goal is to how that people will get that better to best quality or better to best quality of lives. All citizens they are not getting that better health facilities either in that public health care systems or it may be the private health hospital systems. There is some decentralization of powers. Success in the long term battle against disease depends on education and efficient health of infrastructures. So we have to increase the literacy rate or education. When it will be improved, naturally our health facilities will be improved. It is important to create awareness on health and hygiene and provide that efficient systems both in rural areas and urban areas. And there should not be any kinds of differences in between that male and female so far that hospital or as a infrastructure facilities in our health systems. So telecom and IT sectors can play an important role in improving the health process in the economy. Likewise, when we are facing that COVID pandemic systems, that time that IT sectors plays the important role or the telecom sectors play the important role. That three principles: wearing the mask, and second one is that 6 feet distance, and third one that proper sanitation, wash your hands. So this is possible by the guidance of our different ministry, different departments, as well as by the IT departments or the telecom departments. So this is that is why we can reduce our death rate due to these kinds of facilities in our countries. So the efficient of healthcare systems, there are the different kinds of programs on primary healthcare system. So serious steps should be taken to improve them. We have to create the awareness among the people about the education and the health systems. And private public partnerships can be the most important factor which can efficiently ensure the reliability and the quality and affordability of both drugs and medicines. So every people they must try how the people will get the better facilities. They will be well informed and there should not be any kinds of cheating, because at the same time we are getting the so many message or news like this, different kinds of private hospital which way they are exploiting to the different patients, so that the patient are now afraid of to go to the private hospitals also. So these are the different statistical data about the healthcare systems, indicators of healthcare systems, and ISM and also GBD, urban rural and poor rich divides. And beside this we have taken the different of case studies in different states. So likewise I told that like Bihar, Madhya Pradesh, Rajasthan and Uttar Pradesh are relatively lagging behind the healthcare facilities. So doctor, there is the lack of doctor, so that government is taking the necessary steps to open the different kinds of medical colleges and AIMS, as well as we have to establish the different kinds of different places in the different hospitals, specialists, etc., which way people will get that benefits and we can improve our healthcare systems. So I think the chapter is finished of the infrastructure. We have the more two chapters. That is, one is that India, China, Pakistan relations and that economic environments. That is that environment and sustainable developments. Thanks to all of you.